Good evening, friends. Hope all of you are doing truly well. We are here. It's Wednesday for women, of course, and we are here with our uh, prestigious faculty with whom we always love to be, and that is Dr. Girija Wagh. But let me take the liberty to first introduce you to, of course, our channel and this initiative. True Wealth online health channel, as a lot of you by now know, and the ones who are new, is an initiative by the True Wealth Integrative Healthcare, which provides integrative and personalized health and nutrition advice to guide patients and healthy individuals to overcome their health concerns and manage self-help to reach the ultimate goal of holistic health and happiness. True Wealth aims to help you separate science from hype by sharing authentic knowledge and wisdom from healthcare and nutrition stalwarts so you can make the right health and nutrition choices. A quick note that this program is, of course, going to be conducted for education and spreading more awareness to reach the ultimate goal of health and happiness. And the knowledge and experiences shared by the speaker and other participants cannot be treated as a personalized consultation. Every individual, we believe, is different and hence needs an integrative, personalized consultation to prevent or cure ailments. You can always reach us out on 98200483669 or visit our website www.truewealth.in, and we will be very glad to connect you with our very esteemed guest today, which is Dr. Girija Wagh. And having said that, of course, this program will not be providing any direct information on COVID related treatment. For that, you should be approaching your hospitals and doctors assigned by the authorities. Really, the Wednesday for Women initiative is being conducted by Women's Clinic, which is an initiative of Girija Hospital and Fertility Center and True Wealth Integrative Healthcare. The idea behind is to provide health, nutrition, and lifestyle advice. And we urge women under this program to open up and talk to us freely about their health issues and get the medical health check and related treatment, and also get nutrition and lifestyle management advice, personalized advice when it comes to all these three, along with the fitness advice, is what we believe in. Um, Having said that, really introduction to Dr. Girija Wagh. She has 3 decades of experience in normal and high-risk obstetrics and gynecology, IVF, fertility treatment, PCOS, procedures of fertility promoting laparoscopic and hysteroscopy surgeries. She is MBBS and MD uh, in obstetrics and gynecology from the BJ Medical College and Sassoon General Hospital. She has a diploma in advanced gynecological endoscopy from Germany. She is a fellow of the Indian College of Obstetrics and Gynecology, as well as the fellow of Indian College of Surgeons. She is currently a consultant at the Cloud9 Apollo Hospitals, and also is consulting as well as is a professor at the Bharati Hospital, Pune, and also runs her own nursing home, that is the Girija Hospital and Infertility Center in Pune. She has been the chairman of the Medical Disorders Committee at Foxy, and she's very active with this association, or rather a conglomerate of societies, which is actually almost international body, which does a lot of work for gynecological practices, obstetric practices, so that better and better outcomes and care can be given to women. And Dr. Wagh, of course, is a staunch feminist who believes in empowering women through health, and um, her purpose is really to not only treat the women of these generations, but also provide better outcomes when it comes to the next generation. So having said that, a quick intro about me to people who are wondering. I'm Rajashree Gadgil. I have about 2 decades of experience in nutrition, nutritional formulations, continuing medical education, business strategy, branding, and more. I have a master's in science from the Science Hospital, and an MBA in marketing as well. I have experience across therapy areas like of course therapeutic nutrition, orthopedics, gynecology, gastroenterology, and more. I am the founder and CEO of TRUWELLTH Integrative Healthcare, as well as RSG Energy and Nutrition and Healthcare Private Limited. But not to take more time introducing myself, I would really, it's a real pleasure to welcome our guest. And she's our guest every Wednesday, and it's always a pleasure to be with Dr. Girija Wagh. Ma'am, like always, it's a pleasure, and I'm sure we are going to get loads of more information, education, and also how to really address our women health issues. Today is another completely unique topic. A lot is spoken about this very colloquially, but you're actually going to address it scientifically when it comes to pregnancy. Nausea and vomiting is, it is an accompaniment with it. So some experience lesser, but some experience more difficult issues when it comes to it. So really over to you. How are you feeling today? And things are only still getting better, not better, but our Wednesday programs are really catching up very well, and everyone's really appreciating the inputs that we are giving to them.
Yeah, thank you, Rajashree, for that wonderful introduction and a wonderful platform that you have created on this Wednesdays for women. What is very important is this topic, as we realized, is very, very vital. And that's something because today, when we look back and we see inside our practice, we realize that the occurrence of nausea and vomiting during pregnancy is really rising. It's really on the rise. Like if you look at the past times when this particular things were seen, and generally if you even look at the analysis of and survey of this kind of an occurrence, it is found to be very less in certain strata of society. But by and large, today, working women seem to be really affected by this condition. And I think this goes to the fact that the baseline food habits are really not very nice. Because we have undertaken surveys so many times, and through our survey in the practices, when we do the diet recalls of our patients, we really find that the diets are terrible. And then they land up in some sort of food allergies or maybe, some sort of indigestion problems. And then compounded over that is a pregnancy, which gives rise to such kind of a malady. So actually, this has been a busy day today. I had taken off from my clinical practice, and therefore I was only connecting with my phones in need of emergency or on phone calls. So I must thank you for getting me back to be able to connect, because finally I feel that now I'm getting into sort of a, it gives me sort of a withdrawal if I don't connect. And therefore Wednesday is helping me to get back my, my act together. So if so therefore as I said that I would be sharing the blog which I have written some time back, and it's actually just a 5-minute read, and I'm going to use it only as a reference so that I can just reiterate a few very important points. Because if you look at the vomiting and nausea of pregnancy, feeling sick or being sick, is actually a lot of myths are there around this. And if you go back to our Hindi movies, the first thing, long ones, abhi the generation has become very smart. But if you remember our generation Hindi movies, that used to, they typically the woman would get married and then she will start vomiting, and then you will say, okay, it's morning sickness. So it's wonderful to have a morning sickness because you will tend to attract attention of the family and generally you're pampered. But if the vomiting becomes extremely excessive, then that condition is called as hyperemesis. So emesis of pregnancy is vomiting of pregnancy, which may be physiological and which may be something which can be easily contained. But sometimes women may have excessive vomiting, and that excessive vomiting can give rise to problems, and it may be a sign of certain problems which can be there underlying. And therefore, it's very important, because finally, pregnancy is a very wonderful experience. It has to be physiological. And many times, if there's excessive vomiting, not only is the woman very, very unhappy, she feels weak, tired, may go into electrolyte imbalances, but there's also a challenge that the baby's growth can get affected, because as we understand that during the first trimester, that is the first 3 months or 12 weeks of pregnancy, is the time when the placenta is forming, the baby's organs are forming. It is extremely essential that the mother has good load of healthy nutrients at that point of time. And this turns out to be a very precarious balance. If they are not able to sustain good quality of food, how is the placenta and the baby's embryonic plate going to evolve and give rise to a healthy pregnancy? Also, this particular nausea is also sometimes a sign of things not being right. And let's see what I mean by that. Now, first and foremost, let us understand why there is vomiting during pregnancy. Now, this condition is also called as NVP, that is nausea vomiting of pregnancy. So, some women will just have nausea, they won't have vomiting. Some women may just have a trigger of, they'll have nausea, but they cannot just control and they may vomit. Some of them may have retching vomiting. But it is actually a precursor and an extension of the same underlying mechanism, respectively. And as the conception occurs, when the embryo gets attached to the lining of the womb, a typical pregnancy hormone by the name of chorionic gonadotropin, the HCG, as you know, when we do a urine pregnancy test, it comes positive. So this is a very pregnancy specific hormone which gets released into the blood, and it is rising every day in doubling quantities. It is multiplying nearly every, in a normal pregnancy it will double within 48 to 72 hours, and this doubling continues till the pregnancy becomes 12 weeks. And therefore you will find that the vomiting also sort of coincides during the rising levels of HCG. Now, that is usually between 7 weeks to 12 weeks, if the patient will have vomiting. The peak will be somewhere between 8 to 11 weeks. And then gradually, as the HCG starts coming down to a plateau, then the vomiting will gradually subside. Why? Why is this hormone causing so much of vomiting? See, one thing is that it is because this rising levels is trying to stimulate a brain vomiting center. There's a vomiting center in the brain. And every day there is a rising level. So your brain center of vomiting is not able to adjust to it. So that is the reason why it will keep on, and a woman usually will keep on throwing up in the morning. The second component of is that there is underlying gastrocolitis or gastroenteritis. Women already have some amount of acidity, and therefore they have, this excessive vomiting. The third component of this possibility of vomiting is drop in sugars. Suddenly, because there is increase in the metabolism, women tend to have hypoglycemia in the first trimester of pregnancy. So when the sugars suddenly drop down, they feel tired, weak, and nauseated. And then, of course, going hungry for a long period of time. You should never go hungry for more than 5 to 6 hours during the first trimester, because that causes hypoglycemia and that can trigger your vomiting. So, this is the reason why we have to look into carefully and understand. Now, as I have written here, that growing levels of HCG is primarily thought to be responsible. Then there can be, due to increased metabolic needs, there is a drop in the sugars, and there can be an underlying acidity. But there is another component to this, and that is the psychosomatic underplay. Because it is believed that if you vomit, then you are pregnant, or your pregnancy, that means vomiting. But this would happen ideally only in about 20 to 30% of the patient. We find that nearly about 60 to 70% of patients are able to deal with this pregnancy very well. And just because you're vomiting, that doesn't mean that the pregnancy is really going well. Okay, so we have to look at it. Psychosomatic means, in many times, women apparently want to be loved more or looked after more. That's one reason. Or sometimes, that the moment they start having pregnancy change, there is a little backache, there's a little tiredness, and that all starts getting into maybe a sort of an attention seeking behavior. And then once you have had a vomiting, then there's a constant fear: is it going to come, is it going to come, is it going to come? And you're constantly looking for it. So therefore, this kind of a psychosomatic background also can be a possibility. And as I mentioned, it usually is peaking at 8 to 10 weeks. And that is the answer to the next question that we have put on the screen. When is the pregnancy vomiting usually experienced? And it may extend to 14 weeks. Now, here, I must tell you something. If this pregnancy vomiting remains persistent, even after crossing 14 weeks, then it's possible that you are having acidity or some other reason. Plus, if you are having excessive vomiting, there are various differentials that comes in the mind of the doctor. It can be that you are having gastritis, you may be having swollen veins in your the gut tract in the lower part of the esophagus, which is called as varices. You may be having a condition which is called as incisional hernia, where some part of the, not incisional, sorry, diaphragmatic hernia, where the diaphragm has a loop wherein the bowel keeps on coming and then you keep on vomiting and it gets stimulated. It can be that you may be taking some medicines which are inducing a lot of acidity, or it can also be that you may be having jaundice or hepatitis or any kind of such conditions. Even thyroid disorders such as hyperthyroidism is known to cause excessive vomiting. So if you have vomiting, many a times the doctor would put you through these tests. The test would be to identify, is there any other underlying cause other than the pregnancy which is causing so much of vomiting? And the other test would be to identify how much is your vomiting affecting your health. Are you going into starvation? Are you going into dehydration? These would be the actually the gamut of the test that would be performed to identify what is happening. Now, another thing is that if you get this pregnancy suddenly in the second trimester, like you've been always fine, and then in the second trimester of the pregnancy, you suddenly start feeling not so well, sick, nauseated, then the doctor would like to investigate you for a disorder which is called as gestosis or hypertensive disorders of pregnancy, where we all know today that pregnancy acts as a sort of an immunologically challenging issue, and that gives rise to sometimes abnormal response from the mother's body, giving rise to a conglomeration of hypertensive disorders of pregnancy which are characterized by raised blood pressure. So, this rise in blood pressure occurs due to various reasons in pregnancy. And this, if the woman has very high vomiting in the first trimester, then the doctor keeps on keeping a watch. Maybe she has a possibility of developing this later. And if it occurs de novo, that is the first time it is occurring in the second trimester or the third trimester, then this can be a sign of a complication of this hypertensive disorder of pregnancy, for which you will have to be investigated. So your liver function test, kidney function tests are done to be able to diagnose this condition. This has a mnemonic, in our obstetricians jargon, that's called as HELLP. That is, there is hemolysis, there is elevated liver enzymes, there are low platelets, and this is a very special condition. However, to diagnose it, you will have to do laboratory investigations. You can't diagnose it just clinically. Clinically, there would be just rise in blood pressure. So, and this is something that we teach even ourselves and our colleagues and doctors, that if a woman is presenting to you with sickness in the later part of the pregnancy, don't label it because of pregnancy. It can be a sign of something more ominous which requires to be investigated. Now, and these are the things that I was talking about when we discussed, is NVP normal or should I expect any complications? So these are the things that come to the doctor's mind when you have excessive vomiting. And can it be psychological? It is proposed that women who are disturbed, sensitive, unhappy, overworked, have nausea, vomiting of pregnancy often, and also become sick and may need admission. Sometimes it can be an attention seeking act or a reflection of a wrong attitude towards pregnancy, other surroundings, and abnormal response to the changing hormonal effects. And sometimes anxiety, depression can present as NVP of a severe kind. Now, in the long past, I remember our generation, Rajashree, whenever we used to get into a pregnancy or a pregnancy related issue, we all used to be very jubilant and happy. That was our first response. A sense of being happy, sense of a creation, sense of being, whether we are going to continue that pregnancy or not was never on our minds. It was okay, fine, I'm pregnant. And then we used to be always happy. The family used to be happy. The first thing today I'm observing, the moment that pregnancy test comes positive, there is a reaction or a response of fear, anxiety. What's going to happen? Therefore, it's highly important and imperative that all of us, including the doctors and the patients, start looking at pregnancy as a very normal condition. Nature takes care wonderfully if you allow it to take care. If you're going to modify it too much and manipulate it too much, then you may land up in issues. So, coming back to the triggers for nausea vomiting of pregnancy, there are certain triggers which can trigger this condition, like lack of sleep, irregular eating schedule, junk food, excessive spicy food, starvation, strong smells such as tadka, motions, like when you're in the lift or you're riding or driving, can act as a trigger. Overeating can also cause vomiting, and therefore, the dictum and the mantra during pregnancy is small feeds more frequently. So, you take little food, be conscious about what is the composition of your food, and ensure that it is not too much of feeding and digestive challenge, because otherwise, you will not be able to assimilate that food well for its purpose of helping your body grow as well as the baby's body grow. Generally, a working mom would want to stuff herself with food, not wanting to eat outside food, or the loving family wants her to eat to help the baby grow, etc., resulting in forced feeding, and that is also known to trigger nausea vomiting of pregnancy. So, how can one deal with it? First, accept that quizziness is going to be there a little. Self audit your diet and identify whether you are taking proper food, and identify what food suit you best. Identify your triggers and deal with them, and avoid the typical cooking, which is the cause of the trigger. Like is tadka and wo jo, whatever. If you're not liking that particular thing, shift to something else. You can always make a khichdi, or you can make something else. You can make a porridge, or you can make a salad and have, rather than going to that. And I'm sure Rajesh is going to tell us a lot of small tips which can help us in improvising or trying to avoid these nausea triggers. And try to be content, happy, and rested, and always maintain a positive attitude. Do not starve or overeat. Take light, bland meals and easy to cook foods where the cooking does not tire you. Now you are very, very hungry. You could just come from back from office and you decide to take chole and paratha. It's not the right choice, because chole is full of spices and it's very difficult to digest, and therefore it will have a long time in your gastric stomach. It will not go down and it will start triggering vomiting. And then you take paratha is again very, very difficult to digest. So you must choose a better thing. Maybe you could have just started off with a salad or maybe some sort of a drink, and then you could go in for eating something better. So a simple ideal sample diet, which I usually suggest, Rajashri, and you can always suggest and make corrections, is warm water with honey and shredded fresh ginger in the morning, because ginger is known to abate vomiting, and it is also known to reduce acidity.
It's 21 hours.
Then almonds, chew them and add 2 or 3 nachni or wholemeal biscuits. So dry thing first thing in the morning, which is healthy dry stuff. After a while, taking some amla juice can also help. You can have a small bowl of semolina, oats, porridge, fruits, nuts, room temperature milk. Maybe you could add a boiled egg, or maybe sorted paneer or mushrooms there, or maybe a khakra or a besan ladu or a cold flavored milk. You may have a plain dal with roti, ghee, with some raita for lunch. Evening snack can be a dokla upma. You can see that the choices that I'm making usually is a combination of more of proteins and fermented food, so they are digestible. And fruit plate per vegetable smooth, or a vegetable smoothie can be taken. Moong dal khichdi with kokum based sour or curry, Always carry some chocolates, fruits, and nuts and dry snacks with you. Drink water sip by sip. Don't gut, drink water where you will have a rebound kind of a vomiting. And brush when you're brushing, brush with a soft tissue brush and be gentle with your tongue cleaning, as it can trigger a nausea vomiting of pregnancy. So foods are there which can help, and I'm sure Rajesh is going to talk to us about that. And yes, we do give you some medications to prevent vomiting. Most of the medications are pyridoxine. It's always a good practice to start it the moment you're pregnant. Rather than starting once you start getting vomiting, then usually they do not help. Once you start vomiting, then we'll have to start you on a very strong H2 blockers or something like that. So it's always better to start your pyridoxine beforehand, and your practices of not drinking too much of tea, coffee, not going hungry much early. So, can it be something else? As I mentioned, it can be a viral infection, it can be jaundice, it can be a liver abnormality which requires to be investigated. And we will take an example of Saujanya, who is working in an IT firm and has night shifts. Is now 7 weeks pregnant. She eats chips and drinks Coke in the night and comes home tired in the morning and crash to wake up only at 12 and starts vomiting, and it's brought in by for dehydration and sessile continuous vomiting. So, on clinical evaluation, we diagnosed her to have severe gastritis, dehydration, and she was in ketoacidosis, means she was in starvation, where the muscle now starts breaking down to give you energy source to make ketone bodies. And she requires hospitalization for 3 days. So, what could Saujanya have done? Carry some dry, healthy homemade snacks and home, some cold milk, yogurt for the night, avoid tea, coffee, etc. After reaching home, take a cereal with some fruits and nuts and then sleep. Simply modifications help. And can it harm your baby? Yes, it may, if excessive and if others issues coexist. And I hope that I have been able to reach out to you through this small little window, a peek into the nausea vomiting of pregnancy. As Rajashree mentioned, we are always there to help you. Sometimes I have patients who have a lot of gastrocolitis. I refer them to Rajashree, and it helps them just by little bit of dietary modifications that she gives. Many patients find a lot of relief from this particular issue. And it's not only that, why we have to take care, because we should not land up in a situation where you're having excessive vomiting, you are going to affect your pregnancy and your baby, one. And secondly, that residue should not last with you lifelong. Just imagine if you develop some gastric ulcer, or if you develop esophageal varices, and then pregnancy ho gaya, bachcha paida ho gaya, and then after that you are continuing this disorder for lifetime, is not a very nice thing to have. So, back to you, Rajashree. I hope I have been able to cover everything, and this was your expectation. If there are any questions, I'm happy to take them after you finished your discussion on this topic.
Well, one of the most stickiest topics when we talk about pregnancy, and all of us really go through it, and difficult to handle, is the situation. So, a lot of my inputs are going to be, as always, so much aligning to what you've actually spoken. Some of them which are going to be repetitive, I'm just going to
This
try
is so
to
very nice, because we never discuss any of our plans and still we happen to align. That's wonderful.
Yes, absolutely. So I'm sharing a few slides again. Three types of balances really I feel are very important. And just as Madam, you did speak about one of those examples of your patients who's working in IT, and most of us do not realize that it's, as you always say, that it's being pregnant is a big responsibility. So we have to pre-prepare. We've also run sessions on that. This is one thing which we all,
Wonderful, and a wonderful responsibility. Big, but a wonderful responsibility.
yes, yes, and we fail to understand. While some of us get paranoid about it, some of us don't even realize that we have to start for preparing and bringing this balance, getting used to this balance, where we have to sleep well first of all, because that also hampers nausea a lot. And diet, of course, you did mention how you should be eating food. Those habits, not just what you're eating, but those habits have to be falling in place, and having a moderate exercise. fitness is extremely important. So keeping ourselves active is very important. This balance is important. Then the next balance which we talk about is, of course, the balanced plate, where it has to be one-fourth of the plate has to be whole grains, one-fourth has to be proteins, vegetables and fruit has to be next half. So one quarter whole grains, one quarter proteins, and the rest half has to be vegetables and fruits. Also, essential oils are very important for the development of the baby, of course, but for the health throughout. And also make sure that you're not eating fried foods, but are eating those essential fats. These all help, and keeping hydrated, of course. So hydration is again very, very important when it comes to nausea. So keeping that balance. And the third most important balance, which we again are not this isn't spoken about so much, is the balance of alkaline and acidic foods. Because if we don't keep this balance, where acidic foods include meat, poultry, fish, alcohol is complete no-no. So you have to keep it out. But while we're eating good amount of proteins, we are trying to eat whole grains. We also have to balance it well with fruits, nuts, legumes, and so there is a balance between the alkaline and the acidic foods. Otherwise, hyperacidity is going to trigger. It's going to hamper the digestion. So gut health is again very important. If it is not well kept, we don't have good habits, then we are going to be prone to having nausea, and which can get into the vomiting episodes. And like you ma'am said, it can then become a habit again, which is not good in pregnancy. And the so I always recommend that if you're not able to manage your digestion well, resort to enzymes and enzyme supplementation. Because not always the foods that we're eating give are, they cannot be an ample source of enzymes. And plus, we do not cook it in the right way, and the enzymes are again lost. So easily take a good supplementation if needed. These are safe to be taken, and they help us uptake the essential nutrients which are going to be needed for the baby. And it's also going to be needed for the uptake of the immunity nutrients that are right now a big concern. So all that, try to make sure that all of the carbohydrates that we're eating, the excessive proteins now that we're going to eat, also we are recommended that we should be eating fiber. So all of that actually has to be broken down properly, including mainly the fat. Because if it is not broken down well, this can actually be notorious in causing the nausea. And there are various foods also which you can up in your regular regimens of pregnancy nutrition, and which banana, not too much of papaya, but banana, coconut, apples, lemons, all this madam also mentioned, and I'm also going to bring this towards the end as to what should be eaten, are really included in our pregnancy regimen. So they can excess anyways help in aiding the digestion, but also make sure we are focusing on it. This again, we both have been speaking about this in throughout the pregnancy, but micronutrients, again, the antioxidant effects of these micronutrients, plus the effects of the uptake of nutrients, both uh, these important roles vitamins play in our diet is very important. So make sure you're supplementing them. Lots of supplements are right. Supplements are, of course, suggested by Dr. Girija Wagh. Folate is included primarily, of course, but also whenever needed, she does suggest, and I also make sure that it's a part of the diet regimen, nutrition regimen, to include vitamin A, B, B complex, C, D, E, zinc, selenium, copper, magnesium. All of these are very important, and these are so many sources again of these antioxidants. If we consume this well, definite effect is seen on reduction in nausea. If you start early, even before your pregnancy, and while you first come to know that you're pregnant, you should continue doing this. Eating good amount of berries, bananas, the same things you will see that we're repeating here. Pomegranate, all of these are really good when it comes to nausea, taking care of it. Another thing when it comes to supplementation, highly recommend taking we keep having morning drinks And I suggest taking a proper hydration drink, which includes electrolytes, because it makes sure that your hydration is well, not just first trimester, but I think towards the end of till the end of your third trimester, where your AFI is always a concern. You know, the a drink which we can keep as a customary thing, where we get electrolytes, we get multivitamins, minerals, complemented on a with a recommended daily allowance, so that keeps us going well. Also, inclusion of good herbs is a good idea. You know, keeping grapeseed extract, ginger, which is good, tulsi, amla is actually good, ashwagandha, which is considered to be like a sanjeevani booty here, and also all these take care of immunity right now, which is a concern for us. So it boosts the immunity and it maintains the hydration. The nausea and vomiting prevention aids, really, madam did give very good examples. But my examples again are, you know, yogurt smoothies. Make different types of yogurt smoothies. They give us whey. They're giving us proteins. They are also act as probiotics, so they are keeping our gut health very good. They keep acidity in control, so they are really good. Otherwise, you can also have low fat milkshakes if you're able to consume them. They're extremely good. Grape, apricot, apple juices. You can eat a salted, sprinkle a little bit of salt on the apple. Actually, can make you feel good when you are really getting nausea. Watermelon juice, vitamin water, which I suggested earlier in the earlier slide, having fresh ginger ale, ginger tea, amla sharbats, what madam mentioned, eating ice pops, enjoy them if you want to, and but still take care in these kind of pandemic seasons. And salt and crackers, of course, dry cereals, salted nuts that you can eat. You can eat baked potato. I recommend eating curd rice in the night also, which is normally people avoid rice, but you know that keeps your acidity levels in the night low as well. So these are good foods. Then do's and don'ts, which ma'am did mention, of course, you know, that symptoms, and you keep recommending this, madam, that you know people keep so much of length between the foods that they eat, that in the night especially they do not eat well, and when the stomach is empty, that is the time when you're actually going to get the nausea issue. So you can keep it at bay if you eat. Try to eat couple of hours, eat smaller portions, and try to keep away from fried, high-fat foods, spicy foods. Again, spices, which especially make us nauseatic. Just keep away from it. Coffees and sodas are complete no. I would say, you know, people drink it to keep away from nausea, but you know they have sugars in it, and eventuality it's going to up your acidity. So also we eat a lot of lime, and through all this to keep ourselves, you know, it citrus fruits again we use as an aid, but keep that under control. It should not actually put your acidity up, because then it's going to backfire again on you. Also, the fibers that you eat, optimize them. You know, some vegetables, also watch them, like some cruciferous vegetables can make us feel bloated, and that actually can aggravate our nausea. So those are the ones which should be avoided. We should avoid processed meats, preservatives, pesticides. Try to switch into organic produces, so that you know we can stay away from this, both for the nauseas and also for your and the baby's health and growth. So these are some recommendations I have. Madam did mention to keep away from the strong odors, and also if the room that we are eating in or we are staying in all the time should not be stuffy, hot, humid. You know, we have to try to take control of that also, and also avoid you know any excessive fatigue due to exercise. We should take breaks between if we are exercising, because don't do too much of rigorous exercise. Apart from that, you know, I've put, madam, I've put couple of quick recipes. A pumpkin soup, pumpkin carrot soup with ginger. So you know, people can actually dice great pumpkins and saute them with ginger. It's very easy to make once it's cooked. You know, we can just use a hand blender and actually make a cold soup out of it. You know, cool it and put it in the refrigerator. Add some pepper and hint of cream or lemon, whatever you like, and that can actually make you feel really good. So one of those recipes, and another very important point I'm touching upon, you always talk about what we eat, but aromatherapy also has a very great benefit when it comes to nausea and vomiting and keeping away from those obnoxious odors that make us crazy. And we've seen it's not only that these women use it as cosmetics is what is understood, but there are scientific reviews which I have concluded actually that inhaling peppermint oil, spearmint oil, when you feel nauseous, actually improves the system symptoms and makes you feel better very quickly. Some researchers have, they believe that this oil relaxes the gastric muscles and keeps them from cramping up or over contracting. So this essential oil can actually be applied to pressure points, rubbed gently over the stomach and intestinal area, diffused through the air, or you can inhale it by just putting it on your handkerchief, and it can relieve the nausea. So spearmint, peppermint, both are really the same species, better versions of each other. And lavender oil, again, there are lavender oil sometimes it's believed that nausea can actually be brought into stress and anxiety, and lavender essential oil sort of has calming effects and really helps decrease both anxiety and nausea. Also, its antidepressive effects are really appreciated because depression and all these situations women go through, especially when they get pregnant. So nausea can be induced because of it. Apart from just the psychological effects of aromatherapy, lavender essential oil is also believed to be therapeutically effective due to its physiological effects of the inhaled volatile compounds. And calming and antispasmodic effects of lavender is why it is actively used for stomach bug relief also. So it can really actually help in nausea. And third one, which I think really helps, is the lemon essential oil also, because it's one of the most commonly recommended essential oils for morning sickness, especially in pregnant women. And there has been this clinical trial which was very recently in 2014, which was conducted over 100 pregnant women, and they were given both placebo and lemon essential oil, and what was seen that the nausea and vomiting intensity over 24 hours before and during the 4 days of treatment, the scores actually decreased during these 4 days of using inhalation of lemon aromatherapy. So, something which could actually blend these oils together and using them with a right carrier oil, if we can balance it, massage it, and that sort of can actually really create a positive effect in nausea. So trying to give best lucks again, yeah, puts a smile on your face too, ma'am. So I think these were really different inputs. I mean, aroma is an area of interest for women. So, we could use some of these different methodologies to take care of nausea. Uh, I think pretty much, I'm getting some inputs, messages from people. Of course, this was a complete session, so I don't. You've also really addressed risks. There were a couple of questions around, if nausea can actually really be a bigger risk to women, and could that sort of pose risk to the the mother and child's health, is something which was a question that had come up. And if you want to give some insights on that, and just put some concluding remarks for today's program, really.
Yeah. See, what happens is, if you starve, now let's say if you are vomiting too much and then you go into a starvation mode, what happens is, because there is no source of energy, finally all the bodily mechanisms require glucose. Why glucose? Because glucose is the breakdown product of carbohydrates, which is essential for energy. There are various things that are essential for bodily functions. One is glucose, two is proteins for building and sustained a kind of a development of the body, and three is micronutrients to enhance all these procedures to go into place. Now, if there is lack of a metabolic resource, a lack of what you say, a fuel which is essential for metabolism, cellular metabolism, then the body starts looking for fuel somewhere else. And that usually comes from muscle breakdown. And that is something that has to drive across all of us. And that gives rise to release of ketone bodies. And ketone bodies directly cross over and go to the baby. So the baby's metabolism is actually dependent on the mother's glucose levels. So if they are optimum, that is, if they are proper balanced, then the baby will grow well. But if the baby has an alternative of unfortunately growing on ketone bodies, then that can
Yes.
set up a stage for growth restrictions in the baby. And growth restriction is not something that in whom the baby is restricted, I will give birth and then make the baby grow well. That means all its cellular developments, its genetic programming, everything is restricted. And then these babies definitely have challenges in the future where they'll not thrive well. They'll be susceptible to infections on and off. They may be later on suffering from diseases like diabetes, blood pressure, heart diseases. So, this is a typical theory that during pregnancy, the nutrition today during pregnancy also matters a lot. And that is where we have to really look into it very carefully.
A couple of more questions were here. I mean, one, of course, that if you have had a miscarriage or a DNC before, would that actually have you noted it, or are there like studies which say that those kind of women might have more of nausea and vomiting?
No, it can be psychosomatic, most likely. But if
Okay.
patients have problems such as twin pregnancies, or if they have vesicular moles
Yeah.
or these are pathologies, then they will have excessive vomiting. But usually, previous adverse pregnancy effect always gives you a different kind of a psychological,
Yes.
response. A lot of anxiety comes in. You're concerned, you're worried. So it's always better to deal with that unfortunate incidents in a scientific way.
Yeah.
Really try to identify, because there's so many reasons why you would miscarry or the babies would not grow, and most of them are identifiable, and the ones which are not, it's better not to go back and revisit it again and again, because so many studies and evidences have shown today that recurrent pregnancy, miscarriages or anything, there are only very few reasons which would cause such a repeated occurrence. But each one, like there have been so many studies where women, 5 or 6 miscarriages they had, each miscarriage had a different reason. So
Yeah.
it may not always be a repetitive one. So what we should do is idealize your pregnancy planning, conceptional
Yeah.
planning and everything, and go ahead well.
So, what also is sometimes the nausea is considered to be, just a part and parcel of pregnancy. But what are the times, or, what are the symptoms when such women should actually come and see you? When should they feel alarmed about, the vomiting and the nausea?
See, if it is excessive, if it's absolutely not allowing you to have feed, you're feeling weak, tired, you are not able to contain any food, then the patients are automatically they are coming. But even if there is a beginning of a nausea, many times when we write prescriptions to patients like pyridoxine with simple B6, but then still the patient will say, okay, madam, I will take it only when I am vomiting. No, start taking it. Take it on a regular basis. It will keep your pregnancy vomiting away. Because B6 deficiency is known to cause, stimulation of that vomiting center, which I told you, and that gets stabilized. So there's no harm, but despite telling patients very, very diligently, they will still falter. And then it's okay if you don't want to take the medication, then you ensure that your diet habits are good so that you
Yeah.
have the natural sources of these vitamins.
So two more questions, quick questions around food. One, of course, people. I mean, there are families, and we have this traditional thing where you should be eating ladus and pedas and all this. That is highly recommended, and still a lot of women are actually forced to be consuming all this. So, if you could actually, this is really a myth and very difficult to more orthodox way of thinking. What would you say to such people? I'm trying to bring this up because this really makes it difficult for the pregnant woman.
See, first of all, feeding for two is a myth. You should not do this. You should not, just keep on stuffing that patient. Finally, digestion, ingestion, all these are very scientific processes of our body. And that is what we are trying to get through all this Wednesday for Women program, to understand our digestive systems better. The second thing is, taking sugars in any form today are not very helpful. Sugars, maybe through laddus or anything, because sugar unfortunately is gives rise to a lot of immediate stimulation of insulin, and that immediate stimulation of insulin starts stimulating whole lot of metabolic sort of signaling inside the body, giving rise to fat accumulation. Suddenly your sugar levels rise, then you start feeling a little bit better. Immediately the sugar levels come down, and then your body starts looking for something else. So laddus, I have nothing against laddus, but if they are made properly, like there are various ways in which you can make. You can make multigrain laddus, you can make nut laddus. You can sort of, rather than using sugar as a sweetener, you can use maybe pulp of the dry fruits itself. Or maybe you could use an alternative, but jaggery, brown sugar, all are sugars. So we
Yes.
can't, fool ourselves
Yes.
by saying, okay, this is better, that is better.
Yeah.
What
Yeah.
is important is, if you are really have no choice, but you have to eat that laddu now, whatever it
Yeah.
is,
So I
balance it with some salad or
yes.
fruit or something. That would be
Yes.
the smart thing to do.
So in fact, I think the mother-in-laws were actually suggesting that they should be eating a lot of loads of sugar and fat. And when women start getting nausea, they have to realize that, in fact, it's a trigger to realize that they are not eating right. So don't force your daughter-in-laws or daughters to resort to sugar and too much of fat. And because increasingly in our nutrition world, that is something we are suggesting to everyone to stay away from. The one last question, in fact, we're almost close to 1 hour, is the other way around, because today the women are, they want to stay slim. So a lot of them are worried about, putting on too much of baby fat, and maybe along with that, they're putting on too much of fat. That's a concern. And, some of them are already on different types of diets, not to call them fat diets, but, some of them which are really used as fat diets by a lot of women. To them, what would you say? Because they're again resorting to not eating nutritious foods. Then because they're close to the idea to eat carbs at all. Because some of these diets force them, telling them that not to eat carbs, but there is requirement of carbs when it comes to
Yeah, yeah, yeah.
pregnancy. And
See, basically, the carbohydrate requirement, Rajashree, is very typically calculated based on the woman's weight.
yes,
And that also is tweaked a little. If you really scientifically look at it, look at the various guidelines that are mentioning, that first do the patient's pre-pregnancy body mass index. Pre-pregnancy body mass index, if it is found to be optimum, ideal, then
yes,
that woman can take 20 to 25 kilocalories per kg body weight throughout the entire pregnancy. That is one.
yes,
Rule number two is use complex carbohydrates and not take easy
yes,
carbohydrates.
yes,
Rule number three is always use it in balance with some protein or something which will reduce the glycemic index of that carbohydrate.
you're right.
Fiber and all that helps.
Totally,
Because
yeah.
you have to take those carbs. Your weight gain will be determined on your body mass index. So if you are having a normal body mass index, which is ranging between 19 to 25,
Yeah.
then you can put on weight up to 11 to 15 kgs through your pregnancy. But if you are putting on, if you're already on a high overweight or an obese class 1, class 2, then your weight gain allowance is not more than 7 kgs through the entire pregnancy. And this has to be followed, because I always tell patients that if you eat well, your babies will grow well. If you eat wrong, you will only grow. And that is not right, because obesity can cause pressure on her knees, on her spine, on her entire metabolism. So if you look at the various changes that are occurring in the body, from the blood volume to the breast changes to the size of the baby and everything, 11 to 15 kgs in an ideal situation is what we are desiring. Then what do we do with those obese patients? I'll give you an example. Recently, I had a SLE patient who was overweight, who had severe hypothyroidism, was on steroids because of her systemic lupus erythematosus, which is an autoimmune disorder, and she conceived. First visit itself, I told her, you are at risk of miscarriages, growth restriction, complications during pregnancy. Additionally, you are hypothyroid. Additionally, you are overweight. Now, our goal is that you're not going to put on 7 kgs of body, more than 7 kgs throughout the entire pregnancy. Rajashree, this child followed my advice to the hilt. By the time she was 4 months pregnant, she had only put on half a kg weight. In the beginning of her pregnancy, in fact, she lost her weight. When we took her for a delivery, we decided to do a cesarean delivery for her because the baby was presenting in a different way, in a position. So we had to do that. And we delivered her 3 kg absolute healthy baby, no prematurity, at term, planned delivery. And I just told her, you speak to tell the neonatologist, how did we manage this baby's weight despite your illness? So she told the doctor, I only put on 4 kgs during my pregnancy. Just imagine. She said, I followed the mantra that madam had told me, complex carbohydrates, proteins as much as you want, and take loads of fibers. And if you want, sometimes as a source of energy, I feel that we can always replace carbs by taking little bit of fats, healthy fats. I think that works because in pregnancy that helps. Now, you are a nutritionist par excellence and you have so much of a, sort of things. But these are the basic, large, broad rules that I follow when I advise my patients to get. And of course, when I get into complex situations, I put them onto you to deal with them. Your voice is not clear.
Absolutely right that you should be putting them, taking good fats and deriving energy from that, and even proteins can be such a good source of energy. So absolutely right, and you absolutely hit
The
the nail.
diet that you mentioned is the challenge that I find in our patients is the ones who are already on a ketotic diet.
Yes.
And the second challenging patients are the ones who are taking vegan diets. Where are they going to get the protein from? My challenge is
Yes.
protein kahan se aayega?
Yes, yes. And then when they start just depending on pulses, then they start getting gastric disorders, and
But
then
I
nausea
tell them
stops in.
40% of the pulses is carbs.
Yes, totally.
So you can
So
understand that I'm becoming a nutritionist now.
yes, no, you've always been focused on it. So I think that's why most of our sessions really are bang on when it comes to understanding and presenting the integrative approach. And I think that is really what we are proud of. And we are on the 15th episode today, so
Wow.
it's such a it's such a great achievement. Apart from that, we have done 2 or 3 other sessions here and there on different topics, but it's been a great journey, and we're going to keep on with it, and keep coming forth and try addressing all the minor and the larger issues when it comes to women health. It, as always, it like you said, it was a great. If we don't do these Wednesday for women, it's something we totally miss.
Withdrawal. We
Yes.
get a withdrawal.
So it's been a great session with you again today.
I think there's a lot that we can help the pandemic for.
Yes,
Thank, thank the
yes,
pandemic for.
yes, absolutely. Well, so on that positive note, I think we all should stay positive, and we are almost maybe towards the tail of the pandemic, and keep keep your positivity going, women out there, and most of you are have taken the advantage of being pregnant in these times as well. So have happy times, and do well. So, on that note, we will end this show. Viewers, thank you for always coming and encouraging, watching our shows, and spreading this education more and more. I would also like to thank the RSG Energy team headed by Mahesh Darade, who they relentlessly actually forward our talks to different groups, and they try to reach them to maximum number of people so everyone can take advantage of it. So I'm actually just going to play a short promo of RSG Energy for them. And thank you all, everyone. See you next Wednesday.